Friends, good evening. I'm Dr. Ashutosh. Or let us now talk about cord accidents. Right. I do have a lot of videos regarding this true knot cord, and so we can have multiple loops around the neck, which we call as a nuchal cord. Meaning thereby that all these things they can be identified antenatally. But now we are going to talk about a cord presentation. So cord presentation is an entity in which we can see that the membranes are intact, and something around by 8 months, something around the time of the delivery, we have identified that the cord is lying with intact membranes between the cervix and the presenting part, meaning thereby that if it is a breech, and then the head of the baby is up, or a cephalic, meaning thereby that the head of the baby is down, but the cord is the first part. This is close to the cervix and is ahead of the head in a cephalic position, or could be along with the feet in a breech position. So this could be a cord presentation. Now the cord presentation can lead to some complications if we do have a rupture of membranes. So rupture of membranes, meaning thereby that the bag of water bursts, and therefore with the amount of the amniotic fluid that gets leaked out, so you can have this cord which has been presenting can get prolapsed into the vagina, and therefore we can have a cord prolapse. So this would lead to a lot of complications to the baby, and can lead to a difficulty to the baby, and therefore might warrant a emergency cesarean sections. So let us first see this video, and then probably we'll talk about it, that how, what are the high risks and how we can avoid them. So this is a routine ultrasound that we are doing at something around 35 weeks, and what we've identified is this, that this loop of cord, there's a bunch of cord which is ahead of the head, right? And then they're floating in the amniotic fluid ahead of this thing. So we are putting the color, and then we can identify that these are not loop around the neck. Okay, so these are not nuchal cord. So this is a bunch of loop of cord which is there, and this is called as a cord presentation. So this ahead of the head and close to the cervix with intact membranes. So this is cord presentation. So identification of the cord presentation is an omni sign. Actually, we have to avoid artificial rupture of membranes. Eventually, if the back of membranes they rupture spontaneously, then also she has to be told that she should always be lying. She has to come to the hospital lying. She should not stand. She should not walk, because then that increases the risk of a cord prolapse. Cord prolapse is the entity in which the cord comes out into the vagina along with the water amniotic fluid that gets leaked out, and therefore we can have fetal bradycardia, and we can have a stillborn baby. So, if it is a persistent antenatally, if the membranes are intact, and if it is a persistent cord presentation, so probably it warrants for an elective cesarean section, or could be so artificial rupture of membranes has to be avoided whenever we are inducing the baby during the process. So the cord presentation, if it is a persistent one, it warrants for an elective LACS, and the artificial rupture of membranes they have to be avoided. Eventuality may, even though we allow this normal process, and we believe that the cord would go up and then the head would turn down, but if it turns out to be cord prolapse, and then we identify that the cord is coming with the head, is the first part which is coming out ahead of the head in the cervix, and therefore this would warrant an emergency cesarean section, right? Otherwise this can lead to the cord can get pressed, we can have a vasospasm, we can have a decelerations to the fetal heart, and we might even lend to some complications like stillborn baby and all those stuff, right? So I don't know, so this simple finding of identifying the cord ahead of the head in the amniotic fluid with intact membranes is called as a cord presentation. So persistent cord presentation is definitely an indication of elective LSCS, right? So this is how we counsel her that what are the do's and don'ts with the cord presentation, right? Thank you very much for your questions.